Welcome back to Hope, Health, and Ha-Has. I'm your host, Winny, and today's episode is one that is especially close to my heart and so to many of thousands of families across Wisconsin. If you've been following my fertility journey, you know the emotional, physical, and financial reality of treatment. 5 years of IVF, IEI, miscarriage, and failed transfers, and navigating a healthcare system that doesn't always support those who are trying to build a family. And the truth is, Wisconsin is behind. That's why today's conversation is so important. We are here with Senator Kelda Roys, the lead of Wisconsin Building Families Act, groundbreaking legislation that could finally require insurance companies to cover infertility diagnosis, treatment, IVF, and fertility preservation. Why this conversation is so important is because this bill means so much. It still needs to change. And how can we help to move this forward? This episode, every Wisconsin resident and every fertility warrior needs to hear. So let's get started. Welcome, Senator Kelda Roys. How are you today?
I'm so delighted to be with you, Winny. Thank you.
Thank you. So I know you're leading this Wisconsin Building Families Act. Can you talk more about how this got started and why it's so important for you?
Yeah, this is a personal bill for me. I am a mom and stepmom of 5. So I've got 2 young adult stepdaughters now that I helped to raise since they were 4 and 7. And then I've got 3 little ones who are almost 12, 8, and 4. And I, felt very lucky to be able to get pregnant without fertility treatment. But really, you just never know. You never know what life is going to bring. And I wanted to be a mother and had a miscarriage with my first pregnancy. And then after I had my first daughter, really, really wanted a second child. And we were trying for a year and we're not having success with secondary pregnancy. And, I made an appointment at the fertility clinic and, was researching what that journey was going to be like. And then, again, just incredible luck of the draw. I was able to get pregnant before I was able to get into the fertility clinic because there's a long waiting list for a lot of folks, and was able to complete our family. And it's such an incredible privilege, and it makes me furious to think that the ability to have children, to build the family that you want, has become something that only the wealthy can afford. Infertility can affect so many aspects of your life. And when you want a child and are trying to have one and not having success, everything in your life just kind of falls away, because I just know how deep that desire is to become a parent. And I want it to be available to everyone, whether you are wealthy or not.
Thank you so much for sharing your story. And a lot of fertility warriors out there can totally relate to this because, fertility journey is emotionally, mentally draining already. And then on top of that, having to deal with the finance part of it, which in reality, none of us should have to carry that burden. And it should be available for everybody. So based off of that, there's no law mandating fertility treatment or preservation. So why has this legislation taken so long?
Well, I think, the United States has relatively poor access to healthcare for people, for a developed country. We're the only developed nation that rations your healthcare based on the job that you have or the money that you have. And we don't just guarantee it as a right because you're a human being living in a body that needs healthcare. And that's taken an enormous toll on our economy. It's kept people locked into jobs that they may not want. And it's also created just incredibly huge costs as people are not able to get the preventive care or the ability to manage chronic diseases before they become more acute and more costly. And so for something like fertility treatment and diagnosis, it's become essentially specialty care. And maybe if you have a really, really good private insurance plan, it'll be covered and you'll still have to pay a lot out of pocket. But even that's quite limited. And oftentimes what we see when private insurance companies are faced with an expensive treatment, whether it's for cancer, whether it's a surgery, whether it's something new that we're doing for any type of health condition, is the insurance company says, no, I don't want to cover that. And then states will have to come in and say, actually, we're going to mandate that you cover, for instance, oral chemotherapy, or that you're going to cover mammograms for people. And oftentimes it does take that push from public entities to say, no, we expect that this is going to be covered. I mean, remember, this is a country where women were being basically rolled out of the maternity ward and dumped on the street for years because insurance didn't want to pay for them to spend the night in the hospital, right? So sometimes it does take legislative action.
Yeah, so will Wisconsin eventually require employers to include fertility coverage in their health plan? And is this something that the legislation can influence companies?
So Wisconsin currently does not require infertility coverage. There may be some private insurers that do include it based on the plan that you purchase from them. Our bill covers all group health insurance in Wisconsin. So if you're a state employee or if you get your insurance through a private employer, you will be covered. And then you will have this essential benefit as part of the package.
Can you speak to why millions of Wisconsinites pay monthly premium get fertility care, which is a standard medical care, why it hasn't really been included in simple terms? I know you talked about it, but for people that are not familiar with this bill or with insurance.
Yeah, well, in simple terms, it's because it's expensive and most insurance companies are trying to make a profit. We have set up essentially a for-profit insurance company model so that rather than spending our healthcare dollars on providers who are giving you healthcare, like a doctor who's treating you or a dentist who's, filling your cavity, we pay third-party providers, these insurance companies, and then they decide how much to pay the providers, or they negotiate. And they're always trying to have some left over for profit. And the way that they get profit is obviously spending less on medical care. So expensive treatments, especially ones that are not, seen as that common or not as politically potent, they will often exclude from coverage. And, there's also a big history of gender discrimination in healthcare access and health coverage. For instance, I remember when, before the Affordable Care Act, Viagra was always covered by insurance plans to help men achieve erection, but contraception, which women need to plan their pregnancies and for many other health conditions, was often not covered. So women had these big out-of-pocket expenses every month, but sexual and reproductive health things for men are covered, right? So there's all these things are kind of at play in why the costs are high. And also, I think that, people didn't necessarily recognize infertility as a disease or a condition that needs treatment in the same way that for a long time people didn't recognize mental and behavioral health as health issues that require treatment and deserve the same level of care. There's shame, there's stigma, right? There's a sense of isolation. People often don't talk about infertility, don't talk about pregnancy loss. And, in part because it's so painful, but in part because our society doesn't make it easy and likes to often say, well, what are you doing wrong here? And so I think there are a lot of parallels to other like mental and behavioral health issues where we've kind of struggled to get coverage. Or like saying to somebody with lung cancer, oh, well, were you a smoker? Well, they've got lung cancer. Let's try to help them get treatment.
Right. Like for me, being Asian American in the Asian community, we a lot of times tend to wait to have children until we are a lot older. A lot of that is because of the cultural, where it's like get your education and then get a good job. And then by the time that we do have a family, we are in our 40s. And in the Asian community, we don't talk about having issues because in our community, it's shameful. You're a woman, you're expected to be able to carry a child, and it should be easy. And a lot of times, the educational part of it in our community does not understand what is infertility. And as we are older, there is more health issues with trying to have a child. Doctors don't consider it, especially insurance, don't consider that after a year, it is considered as infertility issues,
Right.
sometimes unexplained infertility as well. And I think a lot of it is also due to cultural, more people, especially in the Asian community, they wait till later on in life, especially for women.
Well, and I think that's not unique to the Asian community, right? This is as the economy has changed over the past several generations, many people cannot afford to have children in their 20s as they're pursuing education or training or serving in the military or doing these other things that are demanding. It's very expensive. A lot of people, they want to be married, they want to own a house before they have kids. And those things are becoming increasingly out of reach. People do not find a financial security in today's economy for many, many years, right? And so people who would have been having kids in their 20s are waiting until their 30s or 40s because they just don't feel like they're financially secure. You add on to that, we're the only developed nation that doesn't guarantee some form of paid family and medical leave. And childcare is incredibly expensive. It's often more expensive than college tuition. And, you're supposed to be able to save for college over 18 years, but nobody tells you, oh, by the way, start saving for childcare when you're 10 years old. So there are these broader economic pressures as well.
Right. Thank you so much, Senator Royce, for bringing that up. That is completely true. I mean, cost is so expensive. I even look at my own fertility and speaking to a woman has gone through that. I mean, you're literally putting your savings and hoping for an outcome, and putting more strain on your finances, putting your retirement plan on hold because you want to start a family, and the cost of, adding up everyday life, and you end up losing hope of, is this even possible? And you're not more financially behind because you paid so much into it already.
Right, exactly.
So it's like more stress. Yeah.
Right. And then, of course, if you're successful, then you do have all those huge expenses of having a child.
Yeah. So that kind of goes into this, leading into this question of how do you respond to people who still believes infertility is a luxury or an elective medical issue?
Well, I mean, I just think, what does it mean to live in a good society? And to me, it's that you have the freedom to build the life that you want, right? Somebody doesn't tell you how to think or what books to read. You get to choose a job that, that helps support your family, right? You're not working for poverty wages. You're living the way that you want to live. And a fundamental piece of that has to be about your family and, who you're choosing to live with. And, if you're going to have a partner and if you want to have children, to me, that's really fundamental. And it's frustrating to me that we live in the richest country in the world. And yet the idea of having kids and building a family or having as many kids as you hope to is out of reach because of economics. For so many people, it is unjust. And infertility is just one piece of that. But it's why I am so focused on not just insurance equity for fertility services, but also paid family leave, publicly supported early childhood education, supporting our public school system, opening up our state health insurance and our pension system to anyone to be able to just buy in the way that state employees do, right? There's so much we can do to help people, especially younger people who have been left behind in this economy, live the life that they want, live a life of freedom and self-determination.
Yeah, so Wisconsin, compared to other states, when it comes to fertility coverage and reproductive health protection, we're rated as a grade C. So what does that exactly mean? Like if we were comparing against Illinois or New York, how far behind are we?
Wisconsin really does lag far behind, not just our Midwestern peers, but the country as a whole in reproductive health. And there's so many different things that go into that. We have some of the most onerous restrictions on abortion care. We have one of the most shameful infant mortality and maternal mortality rates in the country. And the racial disparities in infant and maternal mortality are off the charts. So we have just a lot to do in reproductive health in general. Infertility coverage is just one small part of it.
So what challenges do you foresee in getting this act passed, and how could the public help overcome that?
That's a great question. You know, we've introduced this bill for several sessions, and we also introduced just a resolution honoring Infertility Awareness Month, and talking about the struggles and how common infertility is. 1 in 6, 1 in 8, whatever statistics you use, infertility is quite common in this country, and we have not been able to get a single Republican to support either our insurance bill or even the resolution just honoring Fertility Awareness Month. And I think it has everything to do with the way that the anti-abortion movement has demonized fertility treatment. They believe that every fertilized egg is a person with the same legal rights and moral status as you or I, or my 4-year-old. And so they really view fertility treatment as tantamount to murder. I mean, there are states that are seeking the death penalty for women who have abortions. There are hundreds of women every year since the Dobbs decision who have been investigated and even jailed for having miscarriages because they're under suspicion. And so when you have religious extremists that want to impose their narrow worldview on the rest of us and that really reject the notion of science, I think you end up with these big conflicts. And Republicans in Wisconsin have completely they voted against even just a statutory right to IVF. I understand if you don't want to have insurance mandates because you're philosophically opposed to them. That's a legitimate political position. I don't agree with it, but it's legitimate. But the idea, we forced a vote on a bill to basically just say, if you want IVF and you can pay for it, then you have the legal right to get it in Wisconsin. Remember when all of that was happening in Alabama and fertility services were suspended and people were not able to get IVF because of the Dobbs ruling. And every single Republican legislator in the state voted against it, voted against just having the right to birth control and to IVF. And to me, that just tells you everything about how extreme and out of touch today's Republican Party is. They are totally hostile, not just to women who need abortion care or birth control, but to people who are building their families and want to be mothers.
Yeah, it's really frustrating because, I've heard people are going to another state to get treatment, and honestly, I'm one of them. I've done fertility treatment here in Milwaukee, and it costs so much money. And honestly, I'm just I'm not sure if we could go through another round, but also emotionally, mentally. But I also feel the technology and the cost for fertility treatment is very high. I do have insurance, but even with my insurance, it's zero coverage. So everything is out of pocket. Well, after going through this journey and connecting with other fertility warriors and other doctors out of state and learning more about insurance, I found out that my insurance, if I do treatment in New York, is actually covered in New York.
Wow.
And the cost is actually 20% cheaper out of pocket. So when I was doing that, I was like, this is crazy. Knowledge is power, but I'm like, why do I have to fly all the way to New York for different treatment that's more advanced, but also less cost than Wisconsin? And Wisconsin cost is so high. So when I go into the United Healthcare portal, you could compare your health insurance of where you're using it in different states, and the prices are completely different. And I was just floored of how expensive Wisconsin is. So when I found out that we are grade C, but also comparing it to other states and what I've learned from healthcare coverage, I was trying to figure out how can I use my healthcare coverage and use it in New York, but I can't use it here in Wisconsin. It was just mind boggling to me.
And of course, I've heard, because I'm authoring this legislation and I talk about it everywhere, I get emails and people come up and talk to me and they share their stories. And, Wisconsin is losing people. We're losing some of our best and brightest. They are moving to Illinois to work for Illinois companies so that they can be covered by Illinois' insurance mandate. And so this idea that people are making really important life decisions and financial decisions based on what the situation is in their state and having greener grass somewhere else is absolutely true. Wisconsin needs to get our act together if we want to be able to keep and retain our young people.
Right. And people are actually leaving jobs. I've actually thought of leaving my engineering job to work at Starbucks because they have such great health insurance for fertility and surrogacy.
Well, and Winnie, this is one reason why I want to also open up the state health insurance plan to allow anybody to buy in, because I think so many people, it's like you can't just choose the job based on what you like to do or what your skills or experience are. You're choosing based on the benefits that they offer, which really might not even be connected to the tasks of the job. And so you end up with fewer people starting small businesses or becoming entrepreneurs, fewer people able to take time out of the workforce to be a caregiver, like for an aging parent or for a child, and fewer people being able to retire when they want or take a job that they want because they're tied to the health insurance of that employer.
And another thing I want to bring up as well too is I was talking to several doctors here in the Milwaukee area, and it was 2 weeks ago. It was a big convention for fertility, national fertility convention that was held down in Texas.
Mhm.
And as I was researching different approaches in fertility, what I found is with Wisconsin, we have the traditional protocols for fertility treatment, which is typical tests. But for anybody that has unexplained fertility, that's gone through 3 IVFs, 2 IVFs failures, I was asking the question, it's definition of insanity. We keep doing the same thing over and over again.
Right.
But when I look at, other clinics, like for example, in New York, they have not a one size fit all prototype where they have different treatments, specializes in each individual person based off their health. So my question was, why does Wisconsin not have that? And one of the things that was brought up was because of the cost.
Yeah.
And bring that type of treatment as much as the doctors really want to, but because our system is so broken that having that, like for example, PRP, that's something that I'm looking into out in New York after 3 failed IVFs. I was asking, why do we not have PRP here? And the reason is because cost. Insurance don't cover it here, and the likelihood of people actually doing that is very unlikely because it's so expensive. So our system and our hospitals aren't able to even bring that on because they already know that it's not going to generate, but yet it will help people, but people can't afford it. But yet we could go to Illinois for it and they have it there. So I'm just like, our technology is so far behind, but yet we're spending so much money for people that doesn't have the first success, and it's pretty high. 80% of people don't have the first success of the first IVF. I mean, it's
you're doing multiple rounds.
Yeah, and it's not 100% guarantee. So when you want to change the protocol and maybe include different tests, it's all out of pocket. And then on top of that, resources for mental health is even part of the wellness of fertility. That was something that I found as well that I wish insurance would cover is when you go through fertility, what about therapy when it comes to relationships that are navigating through that support? But that's again out of pocket costs because it's considered as elective. It's not just about the shots, it's about the mental health part of it. And then when you come out of it childless, you actually go through trauma. And that was something that I went through was, which I didn't know that even exists, was post-trauma from the fertility treatment being childless. So having to go see a therapy was, guess what it was? Out of pocket because they didn't consider it as a mental health issue.
Right. I mean,
Yeah.
when we decide that healthcare is something that should be rationed based on how much money you have, this is the kind of insanity that you're going to end up with, right? Rather than saying everybody needs healthcare in order to live a decent life, just like everybody needs food, everybody needs shelter. You know, uh, our country is so far behind on recognizing what um, what people need to really thrive. And the irony of it is we actually spend more per person on healthcare in this country than those other countries do, and yet our outcomes are actually worse. So people are less healthy. They die sooner, right? They have more chronic health problems. Our infant mortality and maternal mortality rates are much higher. So it's not like we're even getting anything for the extra money that we're throwing away, because we have this inefficient, profit-driven system where there are so many middlemen between you and your actual healthcare provider. It makes no sense, and it's why I have been so passionate about healthcare advocacy throughout my, 25 years, I guess, in and around politics and state government. One of the happiest days of my life was when I was serving in the state assembly, and we expanded our Badger Care program, our state health insurance program, to cover 80,000 previously uninsured Wisconsinites. Think about how transformational that is for people. And now when we look at the changes that the Republican regime in Washington just did in health insurance, we're seeing maybe 250,000 Wisconsinites poised to lose their insurance coverage. This is a crisis that's going to collapse rural healthcare in this country. So, I mean, you're lucky you live in Milwaukee. Imagine, living anywhere north of Green Bay in this state, and your options for healthcare are just going like this. Hospitals are closing, clinics are closing. You can't go see a specialist. You're going to have to travel to Madison or Milwaukee, or maybe the Twin Cities if you have anything significant going on that requires specialty care. I mean, we're talking about fertility treatment and infertility, but it's a window into everything else that is broken in our healthcare system.
Great. So for listeners who want to support this bill, what are the most effective actions they can take right now?
Well, I would definitely say call your legislators, make your voice known. You can call or email your state senator, your state representative, the governor. But it's also really important to talk about this with other people, right? Write a letter to the editor, post on social media about this. I've got great content on my social media feeds. You can certainly take that, share it with a comment, or email it to people if they're not on a social media platform. We've got to increase awareness and knowledge about this. And, one of the really frustrating things is that one of the things that Trump promised during the campaign was that he was going to get fertility treatment more available and accessible to people. And he has totally broken his promise. In fact, he's done the opposite. He's made it less available and more challenging for people to access fertility treatment and coverage. And we've got to hold our political leaders accountable for what they say, and in his case, for lying and misleading people. And then we have to support the political leaders that are actually doing the things that we want them to do. So making sure that you're showing up, if I have a coffee with Kelda or a town hall, right? Come see me, come talk about this, and make sure other people know as well. I always say you can thank and spank your elected officials, right? So if they do something nice, thank them. If not, send them a little note and tell them why you're unhappy. And I just think that in a democracy, we all have a responsibility to make sure that we're advocating for the issues that are important and working alongside our neighbors to try to build a better world.
Yeah, so if this bill passes, what do you hope Wisconsin will look like in 5 years when it comes to family building? And as you mentioned, this is opening up a way bigger picture when it comes to healthcare system.
Well, my hope is that this bill is just one of many that we're able to pass in the 2027 session, right after next November's elections, because I think we will have a Democratic state Senate. I think the assembly will be very close one way or the other. And of course, I hope to be the Democratic governor, but we can really make some transformational change in this state. Guaranteeing insurance coverage for fertility treatment, just like the way that other diseases are covered. If you get cancer, if you get heart disease, your treatment should be covered. Same with infertility. But I'd also just like to see a real commitment to women's health and maternal and reproductive health, because this country is woefully behind in that. Ultimately, what I really want to see is more freedom for people. I want to see higher wages, lower costs, and life just being more free and more affordable, which is what happens when you give people health security. When people have access to buy into a great, low-cost, high-quality health insurance plan like the one that state employees like me enjoy. When we have publicly supported early childhood education, so that when you have a baby, you're not going to have to drop out of the workforce. You're going to have wonderful, high-quality early childhood enrichment for your kid, so that you can, work and know that your child is being well cared for. All these things are really important investments. I'd love to see young people flocking to Wisconsin, because we're building more housing and housing is becoming more affordable. I want Wisconsin to be a place where no matter who you are or where you're from, you have the freedom to thrive. All of my policies, that is really the goal that I'm working towards. This could be the best place to work, to learn, to raise a family. And, that's the Wisconsin that I grew up in. My parents moved here from elsewhere. I spent my early years in a one-room schoolhouse in rural Taylor County, north of Highway 29. I had a pet goat as a child, and I got a great public education. And that should be what every family gets, what every child gets, is the opportunity to build a great life here, no matter who you are or where you live.
Thank you so much for joining us today, and especially we greatly appreciate it, Senator Kelda Roys, for sharing your insight, your passion, and your commitment for helping Wisconsin families across the entire state for fertility care and health care and advocating for health care in general. I hope this episode that our people that are listening give you clarity, hope, and a deeper understanding of why Wisconsin Buildings Family Act matter and why your voice matters. If you feel inspired, please share this episode, talk about it with your friends, family, reach out to your legislation, and real change happens when we advocate together. Thank you so much again.
Good to be with you, Winnie. Thank you.